I have no idea what this means. Hmm.
As best as we can.
Yes, you can. I don't know if you're looking. Oh, here's that.
Yeah, that was.
Hey, Pat, can you hear me? Pat or Judy, can you hear me? Pat or Judy, can you hear me?
Yes, I can hear you.
Oh, thank you, Judy.
You're
Let me
welcome.
know when the meeting starts. Let me know if you can't hear people. The mics aren't on in that boardroom.
Okay,
So if it starts getting hard to hear, let me know, and we'll just have to have people speak up a little bit.
all right.
You hearing
Thank
me
you,
now?
Ted.
Yep, I hear you, Pat.
Thank you. I'll mute myself again.
Okay.
Okay, we'll call the meeting of the Health and Human Service Board to order now. Due to the COVID-19, this meeting is conducted under the Waupaca County Resolution Number 8, 2020-2021, and Governor Evers Emergency Order Number 1. Following information, this meeting will be broadcast for remote access on a live stream on YouTube. This meeting may inadvertently cause a quorum of other county committees or the County Board of Supervisors. No business decisions of any other committees or the Board of Supervisors will be conducted at this meeting. Participation in person is permitted. The meeting will be conducted using CDC and DHHS guidance regarding social distancing. Tables and chairs will be arranged accordingly. Face coverings are required unless an exception applies. This meeting and all other meetings of this committee are open to the public. Proper notice has been posted and given to the media in accordance with the Wisconsin statute so that the citizenry may be aware of the time, place, and agenda of the meeting. And speaking of the agenda, we have an agenda in front of you. Is there a motion to approve the agenda as written? Jan? Is there a second to that? Sue? It's been made and seconded to approve the agenda as written. Those in favor signify by saying aye.
Aye.
Opposed? Okay, it has been approved. Excuse me. The roll call sheet has circulated. I hope everybody that's here, yes, everyone has their X on it. Then we have the minutes of the previous meeting. There's on your iPad, I believe. It's on mine. I assume it's on everybody else's. You had a chance to look at those minutes.
I'll make a motion to accept the minutes as read.
Okay.
Printed.
Jen moves to accept the minutes as written. Is there a second to that? Dennis? Then seconds it. Any discussion of the minutes? Hearing none, those in favor of the minutes as written signify by saying aye.
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 Opposed? And they have been accepted. The public comment. Seeing none, we'll move on from public comment. General board business, public health COVID-19 updates.
I'll just give some short updates on where we're at with the pandemic. I've got our dashboard up. with our current numbers. So the last few, I'd say the last 2 or 3 weeks, we've kind of leveled off as far as case activity has gone. After, we hit our peak of close to 600 active cases at one period during probably the end of November, early December. And then we steadily saw decreases every week. And the last 2 or 3 weeks we flattened out. We went down to one of our lowest periods 3 weeks ago where we had the fewest active cases and average new cases per day was around 15 or 16. And then we kind of just took a little bit of a step up, and right now, and for the last two, almost 3 weeks, we've averaged around 20 new cases a day. So that's still pretty high activity. That's considered pretty high activity level, but a far cry from where we were during our surge when we were close to 50 cases per day. So we've dropped down to, out of that critical level, still into high activity, but at a level that's, a better direction as far as case activity on a daily basis. And our 7 and 14 day trends, like I said, have kind of flattened out with that about 20 cases per day. We'd still like it to see it continue to go down. The good news is that which is what's been coinciding with our case numbers going down, so have hospitalizations and so have deaths, and those have continued to go down, and they're reporting numbers similar to what they saw pre-surge in August and September. So that's good news too. It's not just a matter of people not getting tested, because if that was the case, we'd still see, I think, more some of the higher numbers in the hospitalizations. So those, and if you can see all of our overall numbers for positive cases, right now 147 active confirmed. When you throw in our probable, which should be included, our antigen test positives, we're over 200 for active, but like I said, in a much better spot than we were during our surge. We're continuing to do all of our disease investigation. We contact all of the positive cases, go over care, do an investigation, ask a lot of questions, go over contacts. There's been some updates on how that's all works, but we're continuing to do that. But now that the vaccine is available, we've been doing planning, pre-planning as much as we could this fall and into December. Now we've got more direction on how we can do things. We applied to be an administrator for the vaccine, which is a process you have to go through. There's a process to get approved and get everything you need to have in place to be able to provide the vaccine. We've done that. We've been approved. And so now we're really gearing up to provide our first clinic for those folks that are in the phase 1A, which are healthcare providers, which also includes long-term care, healthcare providers, and residents. But there's a group within phase 1A, which are unaffiliated healthcare workers. So individuals that aren't associated with a hospital or a clinic where they could get it at the hospital or clinic. And that's where we're gonna try to get some vaccine to be able to provide a clinic for those unaffiliated healthcare workers. So we've already started the process of doing some surveys and try to get an idea of the number of individuals that fit into that phase 1A. And we're planning for in a couple of weeks to have a clinic for that group. So that'll be our first clinic for the COVID vaccine. So exciting to get started on this and to start hopefully getting shots in arms. And it's going to be, our first step from our department, kind of helping move things forward with the vaccine, and hopefully things continue to pick up steam across the state and across the country with the vaccinations. I think starting, there's a little bit of a slow roll. There's a lot of steps in the process to be able to give the vaccine, a lot of logistics. This is an incredible undertaking when you think about, providing a vaccine for a lot of people for a novel virus. But wheels are in motion, and we're hopeful, like I said, to have a clinic in a couple weeks, and hopefully we can help work through the phase 1A group and move into the next group, which would potentially be critical infrastructure and maybe an age group, say 75 and older. I'm not sure that hasn't been defined yet. That'll be defined by the state. And once that's defined, we'll start preparing to help out with that next group. This first group, phase 1A, is going to take us a while. It's going to take the state a while to get through all phase 1A. It's going to take us through January, probably into February, before we start moving into 1B. There's a lot of healthcare workers, when including the unaffiliated healthcare workers and all the individuals that fit under that. It's like 500,000 people in the state that would get vaccinated in that first group. But that's what we've been doing quite a bit. Again, couldn't say enough about our team. We keep on moving from one piece of this pandemic to the next. But we're excited about moving into the vaccination part of this. So we're getting closer. And hopefully at the next meeting, I'll be able to report on vaccinations, how many vaccinations we've been able to provide. So I guess that's just a summary of response activities that we've been up to lately. Not to mention testing and all the other pieces that are still included. Yes.
A couple of questions. What would make me not want to have the vaccine?
Well, I mean, if you've had reactions to vaccines, you want to talk to your doctor about it, getting it. But in general, and all this information is available on CDC and the state Department of Health. All the myths and facts about the vaccine are available to review. I would recommend anybody who has questions about getting the vaccine to go to the CDC's website, to go to the State Department of Health's website, and review all the facts about the vaccine and any vaccine. This has followed the same procedure that all vaccine approvals go through. It was expedited by overlapping some of the processes at the same time.
It was brought to my attention that this vaccine has aluminum in, and I think most of the vaccines have a form of the aluminum in. What other chemicals are in there? And then they also mentioned if you have an immune issue, you shouldn't probably take it.
So all the ingredients for both Moderna and Pfizer, you can find that on their websites, and you can find it on the CDC's website. I haven't reviewed every ingredient in there, but I don't know if as far as I know, aluminum's on there. I'd have to review.
They were saying it can cause early Alzheimer's and mental ailments and autism. And that came out.
I haven't heard any of that. Oh, Dr. Getters, have you heard any of that?
I haven't heard anything about that. I know they took all the heavy metals out of vaccines a number of years ago when people were worried about mercury.
Yeah.
So I don't know, like Jed said, I don't know what's exactly in a vaccine, but I know there's a lot of anti-vaccine people out there that are putting out different stories and stuff. But like he said, if you go to the CDC, they'll answer any questions. And they also have a site where you can put in a question if you have something. But I can't believe that there'd be aluminum in that. It would cause some problems and things of that sort. But there was always that belief that it caused autistic behaviors in kids and stuff like that. So they took mercury out at that time, but they couldn't even have that as a base. So I know they couldn't have any metal in there right now and get it approved, from what I know. But
And you can, like I said, you can actually look up the ingredients on the vaccine.
Okay.
the biggest thing that I've seen is if you have some type of immune compromise that would
Oh, I
not,
know.
that you wouldn't be able to be vaccinated because it probably wouldn't take more than anything.
I know, can't take flu shot.
It's totally different than the flu, even though they say it's like a flu. It's the vaccine is totally made synthetically, so it's not similar to what we use as the vaccine for the flu is made from a protein.
Oh, 8 days. Then,
And they do make a synthetic one, but so that you don't have a protein reaction to it. So
And both the CDC and Wisconsin Department of Health Services have a frequently asked questions page, and a lot of the questions that you may have are going to be on those websites.
okay, thank you.
Any other questions for Jed? Well, Jed, I have one question as being an elderly person. I know that your healthcare providers and that are out there in the front lines working, they have the vaccine basically brought to them and where they're working and given. How will the elderly know when and where to go for the vaccine?
I think when vaccine providers have that availability and to actually get the vaccine for that next group, you'll have to check in with those providers and you'll see announcements. So like, whenever we're going to do a clinic that's going to be open to the public, that'd be something watch our website, watch our Facebook, listen to the radio. Same with the healthcare providers. They're going to have to provide some sort of announcement to let people know how to do it. It may just be you schedule an appointment. I'm not sure yet. That hasn't been determined. And phase 2 or 1B, who's going to fit into that still hasn't been announced yet.
Well, hopefully it'll be better than what we see on the TV in California and Florida, where they're lined up 8 hours.
Yeah, in the football field, weirdly.
Yeah. Anyone else? Well, thank you again, Jed. Each month you give us a very up-to-date and complete report on what's going on, and we appreciate that.
Welcome. Thank you.
Okay. Nutrition program. Melissa, are you here?
Yeah, I am. Do you want me to come up front or can you guys hear me okay? Jen,
hear
should
you.
I please go to the mic?
Judy and Pat, can you hear from Melissa?
What? I'm asking them on Zoom if they can hear me.
Pat, could you hear Melissa from the back?
Pat, can you hear me?
We can hear you when you talk really loud, but I would prefer that you come up to the microphone so it's much more distinguishable. Thank you.
Clear.
Are you?
Probably. Maybe right there.
Feel free to karaoke if you wish.
Oh my gosh, you guys will leave the room very, very quickly. So tonight I'm bringing forward the recommendation from the Committee on Aging meeting from last month in December. We're requesting a transfer of funds from the congregate dining funding that we received to the home delivered meal funding, our home delivered meal program, excuse me. We're requesting the state transfer the maximum that we can from our congregate dining allocation to our home delivered meal allocation. As you know, we spend a lot more funding in the home delivered meal program than we do the congregate dining program. That amount, that 40% transfer that we're requesting is just over $64,000 that we're asking to be moved from one to the other. The Committee on Aging made the recommendation, and I'm asking this body here to approve that recommendation to transfer these funds. This transfer that I'm requesting right now is the request that we make every year, because historically every year the allocation that we receive is much more in congregate dining than home delivered meal funding. So, yes.
I'll make the motion to accept the transfer.
Motion's been made to approve the transfer. Is there a second to that, Dennis? Been made and second. Any discussion on that motion? Melissa, do you have anything more on the motion?
No, not on the motion.
Oh, okay. I didn't want to cut you off there.
No. I did want to take a moment though and introduce can I introduce new aging program supervisor?
Well, let's
Oh, sorry. Okay.
vote on the motion. Okay, those in favor of the motion of transfer of the funds from the congregate to the home meal plan signify by saying aye. Opposed?
Aye.
Okay, that's been approved. Melissa?
Sorry for jumping the gun on that, guys. I would like to introduce Megan Hintz, our new aging programs supervisor. Megan's in the back of the room here, so Megan can be taking over my former position. She was working as our elder benefit specialist. Currently is still in that role right now as we recruit for her position. I'm going to be bringing her on board with the aging program supervisor duties while she's still doing her duties as the elder benefit specialist. So it'll be I anticipate about a 1 to 2 month transition period to get her up and running as we find her replacements and do the training and all that good stuff. So headed in the right direction and filling all those seats. So I'm excited to announce that.
Well, welcome aboard. Okay, we have a resolution number 38 of the legislative 2020-21. It's a donation acceptance. You've had a chance to look at it and think about it. And is there a motion to approve that donation? Supervisor,
Craig moves to approve.
and seconded by Tad, I believe.
Yeah.
Any discussion? Hearing none, those in favor signify by saying aye.
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 Been approved, and we will pass this around to the rest of you to sign. Thank you. Ted? The next thing up is the approval or request of a action, request for action on the relocation of staff time. That we have approved that in HR on Monday. It's gone through that, and now we need to approve it in the Health and Human Service Committee.
With that particular request, or within your packet, there was a memo indicating a request for action that outlines really just a reallocation of resources from taking one full-time position and applying that position to 2 part-time positions, making those full-time. From a budgetary standpoint, it's pretty much a wash. There's no real budgetary impact. Would you agree with that, Erica?
Correct. We did not need any additional funding to make that switch.
So,
Okay, you heard a summary from our director, and as he mentioned, it was in your packet. Is there a motion to approve that rearrangement of staff? Moved by Jan. Is there a second? Seconded by Sue. Discussion?
If I put this on, Jody, be chasing me all around the house. Ooh.
The only question, one of the positions you're eliminating is physical therapy for, is it that we didn't use it a lot, or is there gonna be still opportunity for them to get physical therapy?
no, the position that's being eliminated is a CCS position.
Okay,
And then what we're looking at then, it's a psychotherapist that
not a
we're making full-time. So in essence, what we're doing is we're eliminating the part-time, making them both full-time, but yes, it's a psychotherapist, not physical therapist.
thank you.
Any other questions on the motion or comments on the motion? Hearing none, those in favor of the request for the action on reallocation of staff time signify by saying aye.
Aye.
Opposed? And that has been approved. Food and recreational facility fees. Jen, you're back up.
Skip.
What?
Number E, letter E.
E. Oh, I'm sorry.
That's okay, I'll forgive
I was checking off it before I'd done.
So it's already approved, we're good to go.
Thank you.
In your packet, there are 3 sheets that I will be referencing in regards to the 2021 proposed billing rates. I'll just kind of note that there's not really a lot of changes being requested here. All of the data that 2020 provided us, thanks to COVID, is, we're assuming that we're not forever going to be operating how 2020 has been for us. For some of the folks that aren't familiar, you will see notes on the first page, the first of the billing. You guys can see that, it's the longer one. You'll see their reference that those rates are per WIMPR. As I've shared, I think in the past, the WIMPR report is a state report where we are compiling all of the data related to Medicaid billable services. So all of our expenses, all of the revenues we received, all of the program support, and the state is compiling all of that information to say for Waupaca County to be made whole, not need tax levy to provide those services, this would be the rate that you would have to be reimbursed at. Of course, the state Medicaid doesn't reimburse us at that rate, but we do recognize that as our billable rate, if we're billing to a private insurance company, we will be billing at that rate, so that we are covering our expenses there. I do want to mention that there is the exception related to the CCS program. So CCS is supposed to be 100% reimbursable by Medicaid. I had jumped the gun a little bit and previously had talked about changing our CCS rates based on the reconciliation. But after further discussion with Ted, we think we're going to hold and wait, and we'll continue to use the state interim rates. Part of the component in building that rate is related to the percentage of folks' time that is billable. And as an agency, we're going to be working to spend more focused energy on defining kind of standards, what our expectations would be for billable time. And so we're anticipating that there likely will be an impact kind of in regards to how much time our staff are able to bill. So we're going to hold off. We're going to continue to use the state rates that they've given us. We will still continue to be reimbursed for all of our expenses. It will just happen the following year as part of the reconciliation process.
In the event that we did not break even.
Correct. In the event that we do not break even. Other questions about that? I know it's really technical. Okay.
There's also risk that anything that we receive in excess of expenses needs to be refunded to the state.
Correct, exactly. There are situations where, particularly when it comes to CCS, where counties have decided to increase their billable rates, and then there have been changes in productivity and things like that throughout the year, that the next year when they do the reconciliation process, the state said, okay, you've been overpaid, you county need to pay us back. I can't say that would never happen, but we would like to try to avoid finding ourselves in that situation, because we would not budget anticipating, have to return funds. I will make note, though, that you bring up a good point. You will see under our crisis mental health services, there is quite a drop in the rate there. I guess our crisis workers are extremely efficient and doing a lot of billing, because this rate is actually lower than what Medicaid would pay us. But I don't want to bill Medicaid more than what it costs us, because we would find ourselves again in that situation where they would be, maybe we wouldn't have to cut a check, but they would be deducting from funding coming in.
I don't know if other people have this question, but I'm not clear on how someone's productivity affects the rate.
Sure.
So
So
that connection on.
sure. So well, particularly, let's talk about CCS, because that's easy. So you're supposed to be reimbursed 100%, pay your 100% a CCS worker. If 50% of your time is billable, the way the formula, the rate is built in is to say 50% of your time is captured as admin, 50% is actual billing. Well, now let's say The next year, all of a sudden, you're billing 70% of your time rather than 50% of your time. That calculation, that per unit rate that we came up with based off of 50% billable, 50% not billable. So when we go to bill at that rate and you're now at 70%, we're going to be getting more revenues in than what your position costs. It is complicated, yes.
Good to know.
Okay. The next sheet is our Healthy Connections. You guys can vouch, we've not really done anything for Healthy Connections this year, thanks to COVID. We are holding those rates as they were approved for 2020 in our request. And the same on that last page for transportation. Again, we're requesting to hold our rates over. Any other questions? Did you hear me, Pat? Is that okay?
Probably sleeping.
Yes, it was. I had to unmute myself, Erica.
Oh, I thought you muted me.
No,
No, that's okay. My husband would like a mute button for me, I'm sure.
Craig moves to approve the proposed 2021 billing rates.
Been moved by Supervisor Craig. Is there a second? Second by Dennis. Any further discussion or questions? Hearing none, those in favor signify of the rate, signify by saying aye.
I,
Opposed? It has passed. Now we will get on to
F.
Yeah, food and recreation.
Okay, so the first item is a 2020-2021 refund. And so in your packet, I provided a draft letter kind of explaining the refund. So like a whole lot of things in this world in 2020, things got kind of disrupted, including and especially some of our businesses. With the pandemic, it was safer at home. Some businesses were closed, and a lot of our businesses that we license are places of gathering, so it really affected the businesses. Also, it affected how we operate here at the health department. As far as our response, required a lot of resources and required redeployment of some of our staff too. So typically we renew licenses for our food safety and recreational facilities. Our license year is July 1st to June 30th. We send out renewals in May. So those businesses are licensed to operate. That includes restaurants, bars, hotels, pools, campgrounds, mobile home parks, maybe miss a few, but tattoo and body piercing facilities, all those facilities we license. And this year, because we did redeploy some of our staff, their expenses went to different parts of our budget. And so typically the license fees cover our staff that license and inspect all these facilities. With our redeployment, like I said, some of our expenses went to different parts of our budget, which ended up after all the facilities that did renew paid their licenses, their typical license fees, we had some excess revenues. And so what we'd like to do is, because we had those excess revenues, we'd like to refund a percentage based off of our time reporting and our expenses for all those folks that renewed their licenses for this year. We'd like to refund that and put it towards their renewal of their next license year, which would be the 2021, 2022 license, which we would invoice in May, and the license year begins July 1st. So that's what I'm proposing to do. I mentioned I put a draft letter in there. Also, I believe I put a spreadsheet in there that has the discount, which we estimated about 35% to refund back to those businesses.
Jed, isn't it true that the revenues generated through that need to be used to fund the
Yeah.
program itself? So any excess revenue
Right.
really we're not supposed to just be
Right.
hanging on to?
It's only supposed to be used for the program, expenses for the program. So it can't be redeployed in other parts of the agency or the county or anything like that. It's got to be for the program. So refunding this is, I think, is a logical thing to do for this year, considering our expenses weren't what we typically expect them to be. And I think, obviously, these are some of the businesses too that were really affected by the pandemic. So we're hopeful to be able to do that. So the excess revenues, we do have a reserve account. So what, that would be utilized to manage the expenses of this current year, knowing that we'll have fewer revenues this current year. Any questions?
Motion on that? You need a motion on that refund of revenue?
Yes.
Okay, Jan, is there a second? Dave, any discussion? When I talked to Ted about this, I think on Monday, and among other things on the agenda, the thing that I was most worried about is that when you refund, down the road, are you going to be shortage? But Ted assured me that nobody can keep track of pennies much better than Jed. He knows if his department
Amen, brother.
uses 2 stamps too many. And
We try to keep track of things.
so that put my fears to rest. Okay, we have a motion and a second to approve that refund proposal. Any discussion further? Okay, those in favor signify by saying aye.
Aye.
Opposed? And I think, Jed, that when we do have to have a significant raise down the way, and everything needs to be seemingly raised, I was saying to Ted that when that one business owner says, "What are you raising it again?" Be nice for you or whoever's dealing, be able to say, "Don't you remember 2 years ago there was a refund?"
Sure, yeah.
We always hear with government, everything always goes up. And that, well, this is one time where there's a refund.
Yeah.
So it may pay dividends down the road.
Okay, thank you. The next item is the adjusted fee schedule. So the state Department of Agriculture kind of, well, what they've established how we categorize licenses. And in your packet, I included it's a 2-page fact sheet from administrative rule changes to ATCP 75 fee structure. Basically, there's a formula for how each license fits into a license category. And so, this mostly affects retail food businesses. They used to be assigned by sales volume and a couple other criteria. Now there's a full checklist, table A from that form that you go through, and you're assigned a point or a percentage point for every one that you get checked into, and that basically puts you into the fee category or license category that you would be assigned to. And it doesn't change our fee schedule too much. It really only affects a few licenses. And what it does is where we have 2 fees for what would be the moderate retail food establishment, it puts it into 1. And so we'll just have to reassign maybe I think around 25 to 30 facilities where they are going to fit on the fee schedule. So we haven't changed any of the fees. These are all fees that we have established. It just might change which facility falls into a category. So, and I put a copy of our application with the adjusted fees on the application. And if you look on the application, it would be under retail food service, and it would be not serving meals. So restaurants are considered facilities that serve meals. Not serving meals are like your grocery stores or your quick trips, your convenience stores. Even though they do serve meals, they also just do retail. They usually, if they have a combination, a lot of times they fall into the not serving meals because they're primarily a retail. And really it's that moderate to that simple TCS, moderate and complex, where some might fall into different categories than they had been previous. So what we'll have to do is just go through this formula with each facility and then determine where they fall in which license category, if that makes sense. So that's the only thing that's really changing, but we have to adjust based on how the state has changed the formula for assessing license categories. So maybe a proposal just to accept the changes to the license categories.
Okay, we need a motion, if you so wish, to adjust the licensing categories as outlined by Jed. Motion by Jan, a second by Sue. Now discussion. Hearing none, those in favor signify by saying aye.
Aye.
Has been approved. Okay, advisory committee reports and updates. Those were the Committee on Aging minutes from 12/22/2020. You've had a chance to look at that, and you have any questions, now's the time. Okay, no questions. Go on into finance.
You're up, Erica.
Actually searching for goodies while she's doing that.
I'll just, actually, I can reference you to Liz had sent you the management report to the DHHS board.
I've got it here.
I got it. I even made some little extra notes on there. So just in looking at the income statement, again, this is looking at through November 30th of 2020. Right now, that shows a financial position of $868,000 to the good. At the end of November in 2019, we were looking at a negative balance of $429,000. So the way things are looking right now, I would anticipate that we will end 2020 definitely no worse than zero. It would be amazing if it was zero. But I'm anticipating that we will likely be in a position where we will be adding funds back to our committed fund balance. Barring any, I know there's still some inpatient balances out there, but again, I don't think that will be the case. We did also note that that winter payments came in December, and we received about $94,000 more than we had budgeted. So that will be a component that will help. I know this report is November, but I'm always curious, like, well, what does it look like today? So I just looked it up, and right now, today, we show a positive balance of $233,000. We'll still have some 2020 expenses that will come in that little book, but we also have at least 1.5 months worth of revenue that will also be coming in. Any questions on the income statement? Yeah.
I don't know which one is.
Oh, you want to go on? Yes, that's next. Payment registers.
Well, this one, the payment register, on page 30, you have what, and I wanted to know what the initials SLP meant.
Yeah. Speech and language pathology for the Birth to 3 program. Speech therapy.
Oh, okay.
So I'm going to pass these around for signatures. There are, I think I missed maybe last month. So I need signatures on, I'll start with you, both of them. Because one is the checks that get processed and the other is the credit card.
Did we ever get a motion on those to approve them?
Not
I'm
yet.
just,
I wanted to
well-
ask a question on that.
Is there a motion to approve the November and December
payment register.
payment registers? Okay, Dennis moves, seconded by Supervisor Johnson. Discussion on those?
Yeah, Erica, on the payment register, I noticed we have been, and it's separate. So my question is, when people need to get their cards, their business cards, why can't you do it like once a month in a lump sum? Whereas here you have it on individual.
Are you talking
Would
about?
you be further ahead to do a lump sum versus individual?
So, you're talking about the county's
Business
credit
card.
card, right? So the credit card company that the county uses does take a lump sum payment. They pull from our bank account lump sum for all charges countywide, not just health and human services.
This says business cards.
Oh.
To me,
Oh,
a
you're talking
business
about,
card,
here's my name business
Yes.
card, yes.
why can't you wait 2 to 3 months and then get all of them instead of getting it individually when they come here?
Right, so I think it, a little bit of that depends on, I mean, we have, Liz can vouch that Amanda is trying to purchase as many as possible at one time, but you have staff giving out those cards at different frequencies. We are trying, to bulk and get as many folks as we can, but, I have business cards and I rarely give them out as opposed to maybe, somebody in Child Protective Services is meeting with new different families all the time and giving out their business cards. So I guess I would say, due to the frequency with which they're used would make it, challenging to have everybody on the same cycle.
Well, when I was working in an office, we had to wait until, if it was quarterly or whatever.
Yeah.
Because to me, it's an expense doing an individual.
It is. I do think that speaks to, our customer service though, and, really wanting to make sure that we are being transparent and open with, the residents of the county so that they are easily able to, have access to the folks that they need to.
And part of it too is, depending on the worker, the business cards actually serve as an appointment card reminder on the back. So if it's a therapist or a social worker that needs to meet with that client or for a court date, that's why. Like if they're getting low and they need those appointment card reminders, well, we have to order those. They can't wait. It's different when they're just a blank card, as like Eric said, that's my name. But when they use them also as their appointment card for their clients, that's why sometimes they're staggered. But we do try to use as many in one order as possible. But certain workers have different needs for those cards.
And then Amazon, explain that. We got Amazon throughout this page.
Sure. So I guess it depends. There are a number of the Amazon purchases that are related to Shauna's programs, the Children's Long-Term Support and the Children's CPAP program. I don't know, Shauna, if you want to just mention like some of the things that might be purchased from Amazon.
Yes, we found that we can find things cheaper when we go through Amazon than we buy a lot of sensory items that are recommended from occupational therapists or physical therapists for some of the kids in our long-term programs. And we find that it's cheaper to go through Amazon than some of the specialty stores that are out there. Sometimes it costs double to go through a specialty store, and then we've got shipping costs associated with that too. Whereas Amazon, we have free shipping and things are just cheaper.
A number of Amazon purchases too, particularly in this last year, has been related to PPE, hand sanitizer, wipes, things like that.
Again, I've been so taught that you save up and then you get it. And you gotta be more proactive to look when your supplies are getting low, instead of going every day to get it. Can't you get a better bulk rate if you?
Yeah, for those items, we're definitely buying in bulk. Those things related to the COVID, yeah, those were for sure being purchased in both items. You know, in regards to the purchases that Sean is talking about, those are very client specific things that we're purchasing.
Okay, thank you.
You're welcome. No other questions? Thank
I
you.
appreciate
Thank
getting
you,
my
Erica.
business card within a few days. Jan, sorry. She was very efficient.
Oh, okay.
Okay, we're down to point number 3, personnel, employee updates, resignations, retirements, and recruitment.
You know, right now we're getting close to, being close to fully staffed. I believe we're fully staffed in the management level, and we'd like to introduce our new behavioral health unit manager, Kay. And, you know, if it's all right, you know, Kay, give you a little bit of background of who she is, where she came from, and some of her experience.
I live in Wild Rose. My husband and I, we've lived there, well, I've lived there since I was 13. And we own a home on Lake Napawon. If any of you fish, you probably have been to Lake Napawon. I have 3 children, and they're all finally launched. And I started my career in Jefferson County many years ago, but came back home to Waupaca County, where I was for the last 20 years. And then moved on to Adams County and was there about 6 years. So I was a therapist for many years. I've done PCS work forever as an in-home therapist, and then I moved into management in Adams County. I was a behavioral health manager there, oversaw all the programs that I'm overseeing again. I was very happy and excited about the opening because it cut my drive in half. And I tell you, I've been here, and it's been a very weird time to start, but the staff is amazing. I'm extremely impressed. I'm impressed with this agency. I'm impressed with just the warm welcoming. I don't know, I just have really good vibes. I think I'm where I need to be. And so I'm excited. I'm excited to move forward and get to know everybody. And thank you, guys.
Well, we're happy to have you here with us.
Good, thank you.
I met her at our 6th County CCS CSP. And she was the first one to talk to me.
You can leave it to me to talk.
And introduce herself. So from then, you're on.
And I've appreciated Jan, you know, Adams had never had a board representative as much as we tried. So it's been really nice to see the board members that have attended the regional meeting. It's really important to have the board input, and Jan has done a really nice job with that. And so, yeah, you know, we hugged. I know that was a no, but you know, it's Old Home Week at the 6th County region. I swear everybody moves around and we all know each other.
Well, Jed took notes, so.
Yeah.
You'll be dealing with him tomorrow.
I'll be reprimanded.
I'll stand up for you.
Okay, thanks, Jan.
Well, welcome again.
Thank you so much.
Okay, number 4, director's report and agency overview, which we had gotten through our iPads.
Yeah, just quick, Jerry, on that. You know, we are trying to put together a report for the board monthly, and it has, you know, it is evolving into something that, you know, we hope is going to be beneficial for everyone. As you'll notice, this month we are starting with experimenting with a new format that provides a little more demographics information in regard to how many folks we served, along with just a couple bullet points on significant issues. It's hoped that as we continue to provide demographics, we then be able to create a dashboard that would act as a cover to the report. So it'd be more of an at glance seeing who we're serving and how many and those kinds of things. But we hope that the board likes this report, that it gives the information that we might want to see every month.
So if you have a chance to really review the new format and you have any suggestions or questions, let us know. Because it's I believe it's a document in transition that's being made and adjusted and
Yep, as we go, for example, at the end of the report, you will notice that I did mention a situation that the department had, and what we want to do is be transparent as we can for the board to share, the good, the bad, and the ugly as to what we do. And there was a death by suicide that we were involved in recently that, we were criticized for some issues, and, rightfully so on a couple, I think, not so much on a couple others. But what we want to do is point out those things and let folks know what we're doing to try and address things. For example, in this particular situation, and one of the areas that we have to address is we don't have a standard common response to the community and our community partners when a tragedy like this happens. And the second day that Kay was here, she was fortunate enough to attend a meeting, a debrief meeting on this particular issue, and got to hear some of the challenges that we have to deal with. And like you said, in this particular issue, we just don't have a standard practice or policy as to, well, what do we do when this happens? Who do we reach out to? How do we become engaged? How do we align ourselves with our partners and those things? And that was we didn't do a good job with that. And we are looking at that, and that's something that we have to address. So part of this report is to be able to share those kinds of things as well.
I just want to add that when Ted came here, he said to me and anybody else that was in the room at that time when he first came, that he was going to kind of stand back, observe, watch what's going on, evaluate programs and so on and so forth. Well, he certainly has, and we're seeing some real fruits of those evaluations of not individuals, but of programs and of ways of doing things or ways we weren't doing things. And it's only going to make us a stronger, more effective DHHS department. And as far as I'm concerned, you're doing a super job on that front.
Oh, thank you. Just trying to do the best we can for the people of Waupaca County. That's why we're here. We're here to serve. I think that folks understand that, and we'll just continue to do the best that we can. For example, within that report is a list of kind of things that we have to probably address. One of those is communication with our partners, our community partners. We have to find a way to where our immediate response is, how can we talk to our community partners, and not why shouldn't we? And I'm not saying that in a negative way towards any prior practice or anything like that, but that's been a big beef of our community partners, is that they don't know what we're doing. Doesn't mean that we disclose the deep dark secrets of folks that we're dealing with or that kind of stuff. But if they don't know what we're doing or don't know that we're involved, all it does is create problems, and that is another area that we need to address quickly.
But there's been some real positive movement towards reconciliation with those community partners that were, quite frankly, were estranged from us 6 months ago. And that's a real positive. Jan?
I was with a staff member last evening, and the comment that was brought to my attention was, Ted, they're very personable, and they feel that they can come to you at any time with any of their issues. And to me, that was a positive. So.
Well, that's nice to hear, Jan, because that is typically the way that I try to operate. If folks have something to say, they can say it. They can say it. They can be as candid as they need to be. As long as they don't get personal, like call me old and fat, I know that. But otherwise,
call you Santa Claus.
Yeah. But otherwise, they can. And I hope that part of all of this is we're all just trying to get through this life together and trying to do the best we can. And if we can help each other through that, then that's what we do. Thank you for that feedback.
Okay. Board member reports of meetings attended and general correspondence. Jen,
I want to tell you, I was just elected to serve on the County Mutual Insurance Corporation. And I was reappointed on January 1st, 2021. And I also attended their meeting by Zoom, last meeting December 3rd, 2020. I also am serving right now on the Wisconsin Counties Association Health and Human Service Steering Committee. And our next meeting is March 19, 2021.
you stay very busy. I've observed over
Well,
the
I
years.
felt I was in jail. In my Christmas letter, I said I was in jail. I'm sorry. I need to get out amongst people. This is causing me issues. But anyway, I had to give up a lot. As you know, I sing in the Waupaca choir, and that's no longer taking place this next year. I also sang in a church choir for Christmas, and that wasn't taking place. Bowling was stopped for a period of time. So, I mean, all the things I enjoyed doing, quilting even stopped. So I guess I felt I was in jail.
Well, hopefully we're at the second end of this pandemic that I don't know how long, but 6 months from now, maybe we'll have an entirely different attitude towards our life
We
vis-a-vis the
appreciate
pandemic.
what we were able to do and what we're not able to do now. So, yeah.
Okay, well, it brings us to number 6, adjournment. Is there a motion to adjourn?
I'll make the motion.
Seconded by Sue. Those in favor of adjournment signify by saying aye.
Going to Florida.
Thank you for coming and participating, and I hope you all had a great Christmas and New Year's since our